Good afternoon. Today is June 10th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that despite a surge of coronavirus cases worldwide, and many countries are choosing to end the lockdowns and reopen their economies. At the beginning of the outbreak, governments have rushed to impose lockdowns to curb the spread of the virus. However, this has consequently led to the economies withering. World leaders, perhaps particularly in developing countries, say that continuing the lockdowns may result in an economic catastrophe, particularly among their poor citizens. So now the thinking has changed, and instead of ordering people inside, governments have decided to reopen and accept a greater amount of illness and death as a result. But they're doing this in order to protect the many jobs of their citizens, and they could be dying of hunger, especially many citizens that are poor and in poverty. Reporters around the world are already witnessing the hit, and especially in hard-hit countries like Mexico, Russia, Iran, and Pakistan, reporters are seeing fuller streets and a sharp increase in close contact among people. In New Delhi, India, the traffic is back, along with the dreaded air pollution, which had disappeared during the country's lockdown. The biggest cities, however, are running out of hospital beds, and the peak is still several weeks away in India, despite it opening the lockdowns, and now it may be as a result of these close contacts. Public health officials have argued that regions around the world may need to temporarily close down again, perhaps a number of times, but that's a risk some governments may not be willing to take amid the worst economic crisis in generations. So I think this is really just the debate about whether it's economy or health, and sometimes the virus may be more important than the economy, but other times it may just be that the economic crisis could lead to people also dying of hunger as a result, and some governments are just going to have to choose the economy over the virus. The second thing that I'd like to talk about is that in Indonesia, there may be another problem for the government. A post-pandemic baby boom. Indonesian officials are worried about a possible unintended consequence of the country's coronavirus restrictions, and as people across Indonesia stay home in April, about 10 million married couples stopped using contraception, according to the National Population and Family Planning Agency, which collects data from clinics and hospitals that distribute birth control. Many women couldn't get access to contraceptives because their healthcare provider was closed. Others did not want to risk a visit for fear of catching the virus, and now as a result, officials are expecting a wave of unplanned births next year, many of them to poor families who are already struggling, and this may be an added burden, perhaps also from the coronavirus economic crisis. So, a obstetrician and gynecologist who leads the Family Planning Agency has estimated that there could be 3,700,000 to 500,000 extra births early next year in a country that typically sees about 4.8 million a year, and this could be a setback for Indonesia's extensive efforts to promote smaller families, a key aspect of its fight against child malnutrition. Many poor and young married women in Indonesia get free contraceptives, many through hormone shots, but their clinic visits were disrupted by the virus, and as a result, this could be a serious but however unintended consequence of the virus. The subway system in New York has dramatically changed, and notably, people have been just almost absent from the system as the pandemic drained more than 90% of the subway's usual ridership, and transit officials remain uncertain whether all 5.5 million weekday riders will ever return. A nurse who lives in Brooklyn have said that all my life I've never seen it like this before, where the subway cars are entirely empty, and now the ability of the subway to regain riders' confidence will play a crucial role in the city's recovery. However, the subway's transformation currently just serves as a vivid reminder of the outbreak's aftershocks, and this is just one of many aspects in which the coronavirus has ruined for many people's lives. That's it. Thank you for listening, and I hope you have a good day. Thank you.